I've been waiting all day for this. Baron, my handsome man.
Hi, human.
Hey, babe, you ready? All right, let's roll it.
Hi, everybody. Welcome back to another episode of Soul Sense, where today I am not only joined by a very, very dear friend of mine, but also a gentleman who inspires me in more ways than he probably knows. So, before I go on about this man forever, I'm going to introduce Dr. Fernando to everybody. How are you doing?
Hi there, I'm doing well. Thank you for having me on the show.
Oh, my pleasure. And can you just tell us, there's a doctor before your name, which is a pretty big deal. Can you tell us what it is a little bit about what you do?
Yeah, so I'm a board certified psychiatrist, and I did my residency training at Queen's University. Right now, I used to work at a hospital, and I did an ACT team for a while, which is an assertive community treatment team. But now I actually focus on my private clinic, which is a mental health resource in the community of Woodstock, Ontario.
I love that. So you've just also recently moved into your own practice, and that was something that you did kind of before the transition of COVID and everything started.
It was exactly like very bad timing. So it happened to right at
a little bit about that.
So, I mean, that sort of like made a lot of challenge. It has been a challenge because when you're actually interviewing patients, there's a lot of sort of non-verbal information that you get, and a lot of information that you can get just from like introducing yourself to the patient. So there were challenges, but again, we still wanted to support the community, and especially in mental health.
Yeah, that brings me to my next question is, being in the field that I'm in with wellness and mental wellness and addiction and those kinds of things, it's unfortunate this spike in how busy we've been to be there to support those kinds of things. So my question for you also is, have you noticed a big shift through COVID as to sort of pre-COVID with what's been going on with individuals' mental health and that type of thing?
Yeah. Well, I mean, the thing that I've noticed the most, like, I mean, it's actually more based on what's like, in the literature as well as sort of the discussion groups with mental health professionals, is there's a larger rise in addiction issues as well as domestic violence, which is a major concern for mental health. And also, like, with sort of the schools being closed, we've actually, noticed that, there is an increase in some parts of child mental health. But again, it does sort of often correlate with the issues of like addiction issues and domestic violence, which are on the rise at this point. So that is a big concern for mental health. Otherwise, it's actually been sort of, there hasn't been too much of a change in like the actual like spiking of anxiety where it is an anxiety disorder. There may be people who are dealing with adjustment disorders, which are basically they can be adjustment disorders with mood symptoms or anxiety symptoms, but generally there is a an antecedent to it, which would be COVID or this sort of isolation that is happening. Usually those don't require medications unless they actually do meet the criteria for an anxiety disorder or a mood disorder, etc.
Okay, and that's actually one of the pieces I want to go back and touch on the addiction piece of it, because I do think that as someone who's battled through their own life of addiction and different things, I've always said that through COVID, my biggest superpower was that I wasn't drinking. There was no substance in my life that way, because I feel it took over the edge. Now, we've noticed a lot of people going one or two ways, and addiction has begun to increase a little bit. So what is your thought on the ways in which we're supporting that? Because we don't have for people, I feel we really kind of dropped the ball for individuals who had those support groups in place, if they were dealing with recovery, if they were in recovery. And yes, moving to the online thing was one way of doing it, but I don't think everyone connected to it. So
Right.
how can you speak to ways that we're doing better, but also ways in which we did sort of seemingly let a certain demographic of people down when we went into isolation, right? There was things we weren't offering anymore.
So much like sort of the children and sort of schooling, with addictions being online, so particularly resource groups like the 12-step groups, one thing that we have learned, sort of forgotten, is that finances are, like economics, are a factor, and not everyone actually does have access to like the technology that's necessary or the internet connections. And obviously, you don't want to be going to Starbucks and like doing your like 12-step exercise anonymous. But again, there are also the concepts where I have some mixed feelings about 12-step groups, but what I find is the most important is the connection that people make. And that is actually sort of the make or break of any addictions treatment, is not really what method you're using, be it motivational interviewing, 12 steps, smart recovery, etc. It is the connection that someone makes towards another person and in recovery. And there's even sort of newer theories about addiction being like the illness of attachment or loneliness, where like they even did studies where basically it was done in a scientific manner, but it sounds a little silly the way I'm going to describe it. But it's basically, they used to use the theory where it was like, if rats had access to a opioid in sort of their water bottle, they would choose the opioid over the water, sort of if they had like the choice. And of course, it would lead to dependence and addiction. However, they actually did another study where they put sort of a mouse or rat playland together, where there would be other mice and like so other rodents would be there, and there would be like lots of different things to do, and the connections that the rats could have to each other, like the animals. They actually did not sort of favor the opioid at that point. So there are more theories that like go beyond sort of the simple theory of like the dopamine hypothesis, where if they get the stimulant and or the opioid, whatever, there's a center in the brain called the nucleus accumbens, and that is stimulated by dopamine and also is involved in addictive behaviors. And so the thing is, those areas, were stimulated, but they didn't actually take into account social aspects of addiction, where that is like a connection can be made. And so like the rats would actually have little rat friends and rat partners where they could basically get all they wanted. And so they actually didn't need the opioid or the drug that was added to the water. So it's actually interesting to see that, and that's why I really sort of associate the connections that are made to people during recovery is what is most important. And if you're getting that through a 12-step group, I think that should be encouraged. But with online, there is a limitation to that. So
Yeah, it's one of those things. I think you hit it pretty on the head. So for someone else as well, I don't connect with the groups NA or AA or any of those things. And my way through recovery is much different, and it's not to take away from what that is for the people who it works for. But I believe ultimately at the end of everybody's recovery through addiction or whatever that addictive behavior is, whether it be substance or an act of something, is the belonging, right? And that's the piece that we were missing. And it also speaks to other ways in which we failed. And you speak about youth and kids in public school, and how in a lot of ways school was an exit for people from their domestic violence that was happening in the home, or abuse, or those different things. So what ways have we shown up for these situations for people now going into phase 3, or with the things that we are offering online, or what are some of the resources people have now if they don't have access to online, and how are we showing up even more for them than we have been before?
So I think, we have to take into account the fact that it is an uncomfortable process to go into sort of recovery at first, right? So that online may be helpful for some people where it is sort of creates a slight barrier, like if they're sort of uncomfortable at first. But I think sort of the initial connection is important to to advocate for these patients where a face-to-face meeting can be done with social distancing obviously being a part of it, where if a mask needs to be worn or something like that. Again, I still think that it's not necessarily the physical connection, but the actual sort of social experience does show a lot more, much like when I was saying in my practice, where actions can speak a lot, sort of by just being in the presence of someone. You can tell a lot more from body language and what actually, whether someone is, uncomfortable about a situation. A counselor or sort of addictions a counselor or a therapist can pick up on that and also know whether, is that a place right now this person is ready for. And so that's why I think, there is a more face-to-face component to addictions treatment, as well as any sort of mental health, because you end up sort of missing a lot of things. And so I would advocate, with the safety aspect in place for like COVID-19, because again, we want to sort of maintain safety, but we have to recognize that people are suffering and they do need help at this point. And there is also the whole concept where right now there is nothing, people are losing connections, and they are not there isn't so much of the, what is it called? Um, it's kind of the accountability where if people used to drink sort of only in the evening because they had to get to work in the morning. If they're not working at this point, or there is like no sort of accountability to the groups that they go to, it does sort of lack a certain aspect in early recovery. Definitely, that accountability portion does help people, but again, it's not sort of the only aspect. But I think having that in early recovery is important.
Now, what would you offer for someone who is, maybe just into the first stages of realizing that they are battling a bit of what we'll call COVID depression or anxiety or those things even now, or anxiety for people now that we're moving into phase 3. I mean, we've spent 4 months staying very focused and very isolated and very cautious about what we're doing. And we're still under an emergency act, but yet we're moving into phase 3 of reopening. And that in itself can be causing a lot of anxiety or a lot of triggers for people. And if someone couldn't make it to you or I for some form of support, what could you offer to them as a place to start?
Well, a place to start would be sort of any of the community outreaches that are available, such as CMHA or different health networks, would be sort of accessible through at least even the telephone, if sort of they have that. And it is important to sort of recognize that family doctors are still open in via like the telecommunication version, if it's video conferencing or phone. And I think the big thing is sort of recognizing if the anxiety is affecting function. And so that is basically the concept of mental health, where if a disease sort of process is going on, it can't really it can't actually be defined according to our manual, like we call it the DSM. It's a Diagnostic Statistical Mental Health, but it does have to impair function. that or relationships. So if you know this is starting to happen to a person, they do really need to reach out to either a medical professional or some form of mental health professional so that they can at least be assessed for safety and function. And at that point, temporarily, if medication is necessary or psychotherapy, which can be done, you know, through video chat or the telephone, might be appropriate. It's really sort of difficult with the anxiety disorders, particularly because a big part of it is challenge of avoidance behaviors. And it does kind of have a negative context of saying avoidance behaviors, but again, it is sometimes we like to say something rather than avoidance, it's seeking safety. If a person is not sort of engaging in a particular activity, but we do often try to challenge the patient to see that what happens is when a person gets an anxiety situation, there is a peak performance curve of anxiety where if a certain level of anxiety actually motivates us and makes us perform better, like to a degree. But once you sort of reach the top of that curve and it's affecting your function, it's actually having a negative effect. But most people actually will be able to actually alleviate that anxiety by sustaining a level of anxiety for a brief period of time. And it's generally exposure response prevention. So if somebody is anxious about going out, we would ask them to actually go out for 1 minute and actually stay in that anxiety level rather than sort of using distraction or other techniques to actually increase that level of anxiety for a period of time where eventually the body will actually release a series of neurotransmitters which will reduce the anxiety. But most people actually do not reach that level of because they want to run away because anxiety is telling you to run away. But if you actually stay with it for long enough, your brain will adapt. And it's also the cognitive aspect of it by seeing that the worst case scenario did not happen after 10 minutes. Sort of encourages sort of the psychological component as well as the biological component. So it's appearing to sort of, this is a problem that we're having with COVID is a lot of our therapy portions have been sort of reprimanded and sort of told that they're basically they have to stay home, right? And they have to avoid these things because the law is saying so.
Right.
So people who sort of suffer with anxiety disorders that are not fully treated are going a little bit backwards in their therapy, particularly because they have the reason to actually say, I can't do that right now. But in anxiety disorders, like particularly when it is pure anxiety, as opposed to some form of like trauma-based disorder where it might be hypervigilance rather than anxiety, is like, you know, we actually want to challenge them so that they experience that and know that the worst case scenario doesn't happen.
Right. Okay. I like that. I like that explanation of it was very well said. So I appreciate that very much and sharing it. Can I ask you what you've been doing for your mental health throughout the last 4 months in COVID? What has been the savior for you moving through something? Because even though we are, you know, in a field of mental wellness and addiction or ways in which we help or that kind of thing, we also have our own battles. Like, you know, absolutely. And I think that we as humans who help with these types of things, we also need our own team and our own rituals and different things. So what did you do through COVID, or what are you doing as it's still here for yourself?
So for my mental health, I actually, we do debrief with the members of our team who all have this sort of mental health training. And it does sort of allow us to sort of vent situations, sort of check on each of our own mental health and get sort of a different perspective. So it is sort of that connection concept, which is very helpful. I actually engage in myself in psychotherapy as a patient as opposed to the therapist. And I have found it extremely helpful to sort of engage in that. And it's difficult often for mental health professionals to actually sort of seek that help. But I find that even if I'm not sort of getting a firsthand, concept of help during a particular session, I can often apply that to somebody else. So it does give you more perspective, and it does give you a way of sort of approaching things in a different light. If you find something very helpful, you know, the big thing is that you have to make sure that, you don't replace your emotions with the patient's one. So like maintaining a boundary is important, and not sort of triggering yourself with your own anxieties or whatever your history is, but recognizing sort of that the patient, has these certain emotions, and to validate those emotions. I think that's the most important thing, is sort of with mental health, is validation of an emotion first when you're doing psychotherapy, and then allowing the patient to challenge it if they feel ready, because there is a lot of fear of judgment, which is the big portion of why people will not often express their emotion. And then they will use the term anxiety, they will use the term depression, which are actual medical diagnoses rather than what emotion they're actually feeling. So I find it's very helpful for my patients to actually express their emotions rather than a diagnosis, much like you wouldn't go to a surgeon and say, I feel cancer today.
Perfect.
But yet when you go to a family doctor or like, a mental health professional, they say, I feel depressed, which is a medical diagnosis. You actually want to get sort of their symptoms, because a lot of the times people describe things as anxiety, which are not anxiety, and would not be treated by the particular medication that is defined for anxiety. So when I have a lot of trauma patients, they actually sort of describe what is hypervigilance as anxiety, when that is sort of the autonomic nervous system in overdrive. So that's your heart, lungs, blood pressure all going up and feeling on edge, as opposed to the consistence of worry, which is what anxiety is focused on. And then other times people express anger. So I find it very helpful for them to actually have an emotion wheel. I don't know if we can share a screen on this thing, but I can actually show you what
Yeah,
I use.
it's funny. I just printed an emotion wheel the other day, a feelings wheel.
Yeah.
You could pull it up. That'd be great. And what's funny is I've actually noticed with my own clients lately, when someone says to me they're feeling anxious, I ask them to stop labeling what they're feeling anxiety. And I say, let's get into the sensations of what actually is creating this thing that we're calling anxiety. Because very much like you, I think a lot of the time we're so quick to give something a label because we feel that that's what it's supposed to be, and then we mentally take on that perception of it. But the way that you say it is just at times our nervous system doing the thing that it does, and there is no worry attached to it. I've been really asking them to slow it down. Just what sensations are we feeling? Let's just recognize those instead. So
Exactly. And actually, that is sort of my, like when I start questioning sort of the anxiety sections of my interview, I generally ask them sort of what is happening in your mind and your body. So that actually really sort of defines things without sort of being able to label anxiety as the term. Because, without sort of especially in my field where we would prescribe a medication for anxiety, we actually need to know that it is for anxiety, and because those medications will treat certain aspects of what is generalized anxiety, social anxiety, etc., but will not treat things like anger or hypervigilance. So
so we have to make sure, especially in that we're not, or with people, that they're not missing what's actually going on with.
exactly.
Yeah.
Sort of being able for people to be able to recognize, their emotion rather than their symptom is more important, because again, that's also part of when you're doing therapy. You have to address those emotions rather than sort of using a throw-off phrase as anxiety, where sort of somebody might say they're anxious and go into CBT and actually sort of not benefit from it when it's more like emotional dysregulation, where something like dialectical therapy might be more appropriate. So.
Right. I like that. I like that a lot. I just appreciate you taking time to chat with us today, because I think breaking things down the way that you are and the way that you do is actually very beneficial to the person, the human that you're working with, but also just to share with other people, just in other situations, you know, to be able to recognize or not recognize what the symptoms and feelings and things are that connect to that. So I appreciate it. Do you have anything, is there anything else that you would love to offer up for anyone right now, you know, at this time, or just some things that you find are super beneficial to you in your own life that you could offer anyone else sort of moving through these sort of uncertain times?
Yeah, I think sort of one of the big things that people are losing is routine, and sort of with routine comes accomplishment. So there is a lot of people that are feeling in sort of a sense of not accomplishing much. And what is important is even for patients right now, if they're engaging in some form of activity, having documenting it. So even like taking a picture of whatever you're doing that day, sort of a craft if it is even, allows you to see a sense of accomplishment, sort of getting better, and it gives you a sense of self-esteem, which it really helps people sort of through this difficult time where routine is not sort of a big part of life, because we're finding, you know, that is a big thing where people are not finding a sense of accomplishment, and then they're getting that confused with major depression. And so I like to see if the patient sort of is enjoying doing something and having like measurable results. If, you know, that sense of depression lifts. Again, if it's not lifting and they're not finding joy in things they used to enjoy, that is when, you know, the diagnosis of depression has to be assessed more.
Wonderful. Thank you so much, Dr. F. I hope that we can, you know, continue to build off of this as our first chat moving into a few more, because I think that just your knowledge base and what you have to share is phenomenal. And not everybody has access to that type of thing. So I think it's really great. I appreciate you so much coming on to chat with us today. And I hope everything in Woodstock is just simply amazing. We'll chat with you soon.
Excellent. Well, thank you very much for having me.
My pleasure. I hope you have a fantastic day, and we'll chat with you soon.
You too. Take care.